Hi, I'm Moshier-McDivitt. I'm a capacity building associate with the National Alliance to End Homelessness. This video series is going to focus on some questions that we get regarding retooling transitional housing. When we've been out in communities talking about options for retooling transitional housing, we find that there's a number of questions that are common to a lot of communities that often come up. So what we want to do with this video is answer some of those questions. One of the really good questions that we often get that's actually in some ways a hard question to answer is, what if our organization's executive director or board leadership does not support the retooling process for our transitional housing program, but our continuum of care is moving in that direction? What should we do? And that is a really hard question, particularly for staff person who might be the program directors, and they might, you as a program director might be embracing this concept and understanding that this is a direction your community is moving in, but you're finding some resistance from your leadership at your organization. So I think one of the things that we have to remember, and if we can help educate our leadership of our organizations about this, is that under the Hearth objectives, and not just because it's the Hearth objectives, but I also want to say this because it's the right thing to do, is that communities need to move together as a system. And it's not about what one program is doing separate from another program, but really looking at ourselves is that we have this whole homeless system of resources, and we need to work together, not work as silos, but work together in a continuous system towards our common goals of preventing and ending homelessness. So it's really important to help our leadership of our organizations understand that we're not an isolated organization. And often I know that programs that have been around for a long time, and particularly if you've had leadership that has been in place for a long time, we felt like we're fighting our own battles because our system hasn't worked together, and we often haven't gotten support from other providers in our community or from our continuum of services as a whole. This is really about coming together as a community and thinking about our system as a whole rather than the separate pieces. So sometimes just starting from there and having those conversations with your director or leadership about how you're starting to see that we're thinking as a system, and how do we see our organization fitting into that systemic work can sometimes help start the conversation. I often think that when you're talking with resistant leadership in your organization, it's important to find out what resonates with your executive director, with your leadership in your organization. What's really important to them with the organization? Why do they do what they do? And there's always some ways to find this new way of retooling, connecting with what we believe. If we're really holding on to our traditional way of doing things because we want to really help people make changes in their lives, it's important to talk about how retooling can continue that process of helping people make changes in their lives. So, what is that piece that resonates with the leadership of your organization, and what would be sort of that first piece of the puzzle that we can put in place? I think sometimes when we look at this retooling and there's a resistance, and that we see that our community is headed in one direction and we have some resistance from our leadership, we want to sort of just go in with the whole game, so to speak, and just play the game, and here's where we are and we need to be here. And that can be really overwhelming. So my suggestion is you start in really small increments. If you are working in an organization, you really believe this is something that could really happen, and you're concerned that you don't have the influence, within your organization, think about how you can be a champion. The other thing might be is to think about, if you don't feel like you have the influence, who might have the influence? Is there somebody else within the organization that might have some real influence with the leadership? Is there someone in the community that has some real influence with the leadership? And are these persons that really do understand the direction that the community is taking in moving towards a rapid exit approach and retooling transitional housing? Find that champion, find that influencer that can perhaps sit down and work with that particular person at your leadership level. I think one of the other things too is this is where you want to really connect with your continuum of care planning folks, your coalition leadership, and set up a time that perhaps they can come in. And I always think that having lunch together, sometimes sitting over a meal and talking about things feels less in your face than when we go into someone's office and our defenses are up because we know they're coming to tell us that maybe something we're doing is not the right thing. So I often found in some of the work that I've done is sometimes just sitting down over lunch and just talking about how we see our programs, how we see the community, and how we can think about working together can really be much more productive and moving a the resistant leadership forward in an organization. So perhaps again, even if you as a staff person are trying to think of a way to talk with your leadership, again, doing it in a non-threatening environment can really be beneficial. But tying into your coalition, bringing your coalition leadership into that discussion is a really good way to use them and help the discussion. Again, I want to remind you, it's often important to start in like those small mini steps. Talk about, here's where we're headed and here's where our program is right now. And if we maybe make just this little shift in our program, we can start aligning ourselves more closely with the direction that the coalition is going. So, start in small increments. Where can you have the influence, and what are some small steps you can do to start really helping your leadership move more in the direction that your coalition and your continuum of care leadership is moving in. I'm Moshier-McDivitt, and we're talking about retooling transitional housing.